Hi, have you ever missed something about yourself? Like really missed something about yourself? Like maybe that time you were just a kid and didn't have to worry about facial acne. Or maybe that time you didn't have stretch marks and could have worn your bikini or your bathing suit freely and confidently at the beach. Well, today my presentation is based on tinea versicolor. It is a fungal infection of the skin that is mostly commonly seen in young adults or adolescents. And I'm going to explain its causes, its symptoms, and how to treat it. So, what is tinea versicolor exactly? It is a fungal infection of the skin that is caused by a yeast. And it is mostly and commonly seen in young adults and adolescents. The term versicolor refers to the discoloration of the skin that is affected. It is mostly seen a light color than the individual's actual skin pigment. Now, moving on to what the causes are of tinea versicolor. It is caused by yeast, and some factors which may promote the growth of this yeast on the skin are hot and humid weather, tight clothing, hormonal changes, excessive sweating, oily skin, and a very weak immune system. Or just a weak immune system. It doesn't have to be very weak. It could just be weak. Okay, now let's talk about the symptoms and the effects of tinea versicolor. The acidic bleach from the growing yeast causes the areas of the skin to be a different color than the actual pigment of the skin. Specific signs and symptoms of the infection include patches that may be white, pink, brown, and also can be lighter or darker than the skin around it. Now, the spots that do not tan the way the rest of the skin does. So if you notice that you have tinea versicolor, it is not good or recommended to tan. Or if you do plan to tan and go to the beach, it is recommended to always use sunscreen, because if you don't use sunscreen and you just tan without lotion or sunscreen, the spot that's infected can become way discolored and way lighter than the pigment of your actual skin and make the infection spread faster and look worse, 10 times worse. Also, other symptoms can be spots that are commonly seen on the neck, the chest, the back area, and your arms. Also, the affected areas may be dry and scaly and may also cause itching. Okay, so down to our last point of the topic, and that's how to treat it. So treatments of tinea versicolor can come in forms of lotions, shampoos, and creams. Also medication that come in the form of pills that can be prescribed by a family doctor, a dermatologist, or even a doctor from a walk-in clinic if you don't have the other two. Now, a very commonly and a very great over-the-counter product that you can get at most drugstores to treat tinea versicolor is Salsam Blue, extra strength 2.5%, which is mostly recommended by doctors. And yeah, like, this is a great product to use if you ever notice that your skin is becoming infected by tinea versicolor. It's a great product to use. It's $13 at most drugstores like Lawton's, Shoppers Drug Mart, and other drugstores. Now, before I conclude, I would like to mention that tinea versicolor can occur in all ethnic backgrounds. However, the condition is mostly common in adolescents and young adults like myself. And if you ever notice signs of tinea versicolor, it is best recommended to treat it early so it doesn't spread about the body. Thank you.